Recording in progress.
Session resumed. Majority Leader.
Madam Speaker, I move that we now proceed with additional reference of business, and may I ask the Secretary General to be directed to read the titles of the bills, resolution on first reading, as well as communication and committee reports. I so move, Madam Speaker.
The Secretary General is directed to read the titles of the bills, resolutions, committee reports, and communications.
Additional reference of business. Bill on first reading, House Bill 10695, amending Section 18, Book 7, Chapter 3 of the Administrative Code of the Philippines by Representative Benitez.
To the Committee on Legislative Franchise.
Resolutions. House Resolution 2463, commending the Gubat St. Anthony Cooperative for their exemplary contribution to community building and cooperative development. Representative Kanama.
To the Committee on Cooperative Development.
House Resolution 2464, urging the House Committee on Appropriations to augment the 2022 national budget for rehabilitation and relief in the aftermath of Typhoon Odette in the Dinagat Islands by Representative Ecleo.
To the Committee on Appropriations.
House Resolution 2465, congratulating and commending Mark Magsayo for winning WBC Men's Featherweight Championship Belt Boxing Division by Representative Olivares.
To the Committee on Youth and Sports Development.
House Resolution 2466, congratulating and commending Jessel Mark Magnifico Araula Bagsayo for winning the WBC Featherweight Championship last January 23, 2022 at Atlantic City, New Jersey, USA by Representative Chato.
To the Committee on Youth and Sports Development.
House Resolution 2467, urging the House Committee on Agriculture and Food to investigate the impact of importation of round scad fish or galunggong on the livelihood and economic status of small fishers by Representatives Culiamat, Zarate, Gaite, Brosas, Castro France, and Elago.
To the Committee on Rules.
Message from the Senate. Message dated January 24, 2022, informing the House that on January 17, 2022, the Senate designated Senators Recto, Zubiri, and Drilon as conferees to the Bicameral Conference Committee on the disagreeing provisions of Senate Bill 2239 and House Bill 9007.
To the Committee on Rules.
Communications, letters, and emails from certain municipal mayors, city mayors, and provincial governors informing the House of their reports on fund utilization and status of programs, projects, activities, implementation relative to LGSFs and Bayanihan Grant to cities, municipalities, and provinces for certain months of 2021.
To the Committee on Appropriations.
Letter dated December 10, 2021, the BSP Governor, submitting to the House a copy of their report on economic and financial developments in the Philippines for the third quarter of 2021.
To the Committee on Banks and Financial Intermediaries.
Email dated January 18, 2022, of the BOC Commissioner, Department of Finance, submitting to the House a copy of their 2021 accomplishment report.
To the Committee on Ways and Means.
Letter dated January 20, 2022, of the BSP Deputy Director, Office of the General Counsel and Legal Services, transmitting to the House duly certified copies of certain BSP issuances.
To the Committee on Banks and Financial Intermediaries.
Committee reports. Report number 1431 of the Committees on Revision of Laws and Appropriations on House Bill 10703. Report number 1432 of the Committees on Higher and Technical Education, Appropriations, and Ways and Means on House Bill 10704. Report number 1433 of the Committee on Youth and Sports Development on House Resolution 2470.
All aforementioned committee reports are referred to the Committee on Rules. Majority Leader.
Madam Speaker, 1 minute suspension.
Session suspended.
Yan na.
Ano pong bill?
Yes, ma'am. Pero nakausap ko man kanina si Secretary din po. Sabi, kung sakali raw, baka pwede ho, maya-maya daw. Unahin muna natin daw, ma'am, yung mga legislation. Kasi mga second reading daw po kung sakali, ano. Ah, tawagan ko po siya ulit mamaya, ma'am, kung ano. Salamat po. Economic Affairs? Okay. Si Ma'am Stella, ano?
Ano tayo? Session resumed. Majority Leader.
Madam Speaker, with leave of the House, I move that we consider calendar of business for the day. I so move, Madam Speaker.
Are there any objections? Hearing none, the motion is approved.
Madam Speaker, I move that we consider House Bill 10625 under Committee Report 1388, submitted by the Committee on Economic Affairs. And for this purpose, may I request the Secretary General be directed to read the title of the bill.
The Secretary General is directed to read the title of the bill.
House Bill 10625, an act creating the Department of Economics and Development Planning, defining its functions and appropriating funds therefore.
Majority Leader.
Madam Speaker, I move that we open the period of sponsorship and debate.
Is there any objection? The chair hears none. The motion is approved. Majority Leader.
Madam Speaker, I move that we recognize Honorable Stella Kimbo to sponsor the measure.
The Honorable Stella Kimbo is recognized to sponsor the measure.
Madam Speaker, I move that we adopt the explanatory note of House Bill 10625 as sponsorship speech.
Majority Leader.
Madam Speaker, there being no other member who wishes to interpolate the sponsor.
Is
Madam
there any
Speaker.
objection? The chair hears none. The motion is approved. Majority Leader.
Madam Speaker, there being no other member who wishes to interpolate the sponsor, I move that we close the period of sponsorship and debate.
Is there any objection? The chair hears none. The motion is approved. Majority Leader.
Madam Speaker, I move that we open the period of amendments.
Is there any objection? The chair hears none. The motion is approved.
Madam Speaker, there being no other member who wishes to introduce committee amendment nor individual amendment, I move that we close the period of amendments.
Is there any objection? The chair hears none. The motion is approved.
Madam Speaker, I move for vote for second reading House Bill 10625. I so move, Madam Speaker.
Those who are in favor say aye.
Aye.
Those who are against say nay. The ayes have it. House Bill 10625 is now approved on second reading. Majority Leader.
Madam Speaker, I move for the consideration of House Bill 10697 under Committee Report 1426, submitted by the Committee on Health. For this purpose, may I request the Secretary General be directed to read the title of the bill.
The Secretary General is directed to read the title of the House Bill.
House Bill 10697, an act establishing the National Center for Geriatric Health and Research Institute, defining its powers and functions, creating regional geriatric specialty centers in the Department of Health, retained hospitals, and appropriating funds therefore.
Majority Leader.
Madam Speaker, I move that we open the period of sponsorship and debate.
Is there any objection? The chair hears none. The motion is approved. Majority Leader.
Madam Speaker, I move that we recognize Honorable Deputy Speaker Benny Abante of 6th District of Manila to sponsor the measure.
The Honorable Benny Abante is recognized to sponsor the measure.
Thank you, Madam Speaker. Can you hear me loud and clear?
Yes, you may proceed.
Okay, Madam Speaker, my friends and colleagues, the 18th Congress, mga kababayan, magandang hapon po sa inyo lahat. As one of the principal authors of Committee Report number 1426 on House Bill 10697 on establishing the National Center for Geriatric Health and Research Institute, defining its powers and functions, creating regional geriatric special centers in the Department of Health, retained hospitals, and appropriating funds therefore. Allow me to sponsor the proposed legislation in behalf of the chairperson, Representative Angelina Helen D. Eltan, who is attending an equally important meeting. It is a privilege to be given the opportunity to speak this afternoon about a cause that I have championed since I was given the honor to represent the 6th District of Manila. The welfare of our senior citizens, ang kapakanan ng ating mga lolo at lola. Hindi lamang po ako ang concern sa ating mga lolo at lola, malinaw po na mahal ng Kamara ang ating mga senior citizens. In 1991, Congress passed Republic Act 7432 or the Senior Citizens Act of 1991, which granted a 20% discount for senior citizens on fares for domestic transportation and the availment of services from hotels, lodging houses, restaurants, theaters, recreation centers, as well as the purchase of drugs and medicines anywhere in the country. The House followed that up with the Public Act 9257, otherwise known as the Expanded Senior Citizens Act of 2003, which expanded the coverage of the benefits and privileges for senior citizens by making it mandatory for business establishments to grant a 20% discount on goods and services. Later, in the 14th Congress, Madam Speaker, my dear colleagues, I was one of those who wholeheartedly supported Republic Act 9994, or the Expanded Senior Citizens Act of 2010, which added the 12% VAT exemption to the 20% discount for senior citizens and mandated additional government assistance like social pensions, mandatory PhilHealth coverage, social safety nets, and death benefit assistance. Ito po ay patunay, Madam Speaker, my colleagues, na nandyan po ang Kongreso para sa ating mga lolo at lola. Kaya ako po ay may kumpiyansa na maaasahan nila tayo, na maaasahan nila ang suporta natin para sa isang ospital na tutugunan ang kalusugan at karamdaman ng ating mga senior citizens. At present, 8.2 million of the country's 109 million people are already aged 60 and above, with 5% of our Filipinos 65 and older. And Madam Speaker, the number of older people is increasing rapidly, faster than the growth in our total population. At the present condition of our healthcare delivery system, the elderly are not easily provided the specialized healthcare appropriate for their needs as they suffer from multiple and chronic diseases. These senior citizens need long-term and constant care from various disciplines. In this regard, a model of care providing comprehensive health services to the elderly at all levels of the healthcare delivery system is imperative to meet their growing urgent demands. The primary objective, Madam Speaker, my colleagues, of this House measure is to classify the existing National Center for Geriatric Health, presently located at the Jose R. Reyes Memorial Medical Center, to be a teaching, research, and training hospital that shall specialize in geriatric care and shall serve as an apex hospital or end referral facility for senior citizens in the country. It shall be renamed as the National Center for Geriatric Health and Research Institute, or NCGHRI, and shall be under the direct control and supervision of the Department of Health. Among the powers and functions of the NCGHRI, Madam Speaker, are to provide and maintain affordable, quality, and timely people-centered hospital care through an efficient health service delivery system for senior citizens, and to provide higher and up-to-date geriatric training for professionals, postgraduates, academics, and allied healthcare providers. In line with this, Madam Speaker, other geriatric specialty centers shall also be established in DOH regional hospitals, which shall also serve as APEX or end referral hospitals, as well as training and research facilities on geriatric specialty care services. More importantly, Madam Speaker and my colleagues, geriatric health services shall be made available in all government primary health facilities. Sa panukalang ito, Madam Speaker, hindi bababa sa 70% hospital beds ng NCGHRI ay ibibigay sa mga indigent patients. Ulitin ko po, such a facility is needed now more than ever. The COVID-19 pandemic is a grim reminder of how vulnerable our elderly are to sickness and disease. All of us here know that firsthand. I know it firsthand because I'm also a senior citizen right now, Madam Speaker. We have lost former colleagues and contemporaries, lost older family members and loved ones, lost old friends and mentors. The data tells a tragic tale. In July 2021, the World Health Organization said, and I quote, in the Philippines, 7 out of 10 deaths are in patients 60 years old and above. End of quote. 70%, Madam Speaker, assuming this figure is still accurate, this means that out of the 53,958 Filipinos who have lost their lives to COVID-19, as many as 37,810 were senior citizens. Ang ating mga lolo at lola, gone too soon. Kaya prioridad ang ating mga senior citizens sa bakuna. Kaya prioridad ang ating mga senior citizens na may COVID sa ating mga ospital. Madam Speaker, knowing what we know about how vulnerable our senior citizens are to sickness and disease, and knowing what we know about how special treatment is often necessary to care for the health of our elderly, it is clear that our country needs a National Geriatric Health and Research Institute. And I would like at this point in time also appreciate the support of the majority of our congressmen for this measure, Madam Speaker. In this regard, I humbly urge the members of the 18th Congress to support House Bill 10697 so we can provide our lolos and lolas with the medical care they need. Medical care they have earned, medical care they are due, medical care they are entitled to. Maraming salamat po, Madam Speaker, my colleagues. Salamat po sa inyo lahat.
Majority Leader.
Madam Speaker, I move that we recognize Honorable Cheryl P. Deloso Montalia of 2nd District of Zambales to deliver her sponsorship speech.
The Honorable Cheryl De Loso Montalia is recognized to deliver her sponsorship speech.
Thank you, Madam Speaker. Good afternoon, Madam Speaker and my dear colleagues. It is an honor for me to sponsor, as one of the principal authors, the bill entitled An Act Establishing the National Center for Geriatric Health and Research Institute, defining its powers and function, creating the regional geriatric specialty centers in the Department of Health, retained hospitals, and appropriating funds therefore. Mr. Speaker, the unprecedented increase in human longevity in the 20th century has resulted in the phenomenon of population aging all over the world. Countries with large populations, such as the Philippines, have a large number of people now aged 60 years or more. The population over the age of 60 years has tripled in the last 50 years and will relentlessly increase in the near future. In 2001, for example, the proportion of older people was 7.7%, which increased to 8.14% in 2011 and 8.94% in 2016. The expectancy of life at birth during 1996 to 2001 was 62.3 years for males and 63.39 years for female. The projected data for the periods 2001 to 2006, 2006 to 2011, and 2011 to 2016 are 63.87 and 65.43, 65.65 and 67.22, and 67.04 and 68.8 years, respectively, for males and females. Along with rising numbers, the expectancy of life at birth is also consistently increasing, indicating that a large number of people are likely to live longer than before. Several studies in gerontology have also shown that, number one, the burden of morbidity in old age is enormous. Number two, non-communicable diseases, both lifestyle-related and degenerative, are extremely common in older people, irrespective of socioeconomic status. And number three, disabilities are very frequent, which affect the functionality in old age, compromising the ability to pursue the activities of daily living. The prevalence and incidence of diseases as well as hospitalization rates are much higher in older people than the total population. It is also reported that 8% of older Filipinos were confined to their homes or bed. The proportion of such immobile or homebound people rose with age to 27% after the age of 80 years. Women were more frequently affected than males in both rural areas and the cities. The survey estimated the state of self-perceived health status of older people. A good or fair condition of health was reported by 55 to 63% of people with sickness and 77 to 78% of people without one. In contrast, about 13 to 17% of survey population without any sickness reported ill health. It is possible that many older people take ill health in their stride as a part of usual normal aging. This observation has a lot of significance as self-perceived health status is an important indicator of health service utilization and compliance to treatment interventions. Madam Speaker, the Philippines was among the first countries to ratify the United Nations Convention on Rights of Persons with Disabilities, which has come into effect on May 3, 2008. Under Article 25 of UNCRPD, the health services needed by persons with disabilities, where a large percentage of our elderly belongs, should be provided as close to the people's own communities, including the rural areas. Elderly healthcare must form part of the general healthcare system, considering that as the elderly suffers from the multiple chronic and disabling diseases, it becomes difficult for them to run from pillar and post to get appropriate healthcare. However, the general healthcare system in our country is not adequately sensitized to the needs of elderly. In fact, undergraduate medical curriculum does not cover all aspects of geriatric care adequately. Postgraduate geriatric courses are also grossly deficient in the country. Thus, House Bill number 10697, as contained in the Committee Report number 1426, aims to ensure that holistic health services are available and accessible to all senior citizens all over the country through the establishment of a specialized hospital and research institute, as well as geriatric specialist centers in every region. Among the key provisions of this bill include the reclassification of the existing National Center for Geriatric Health, presently located at Jose R. Reyes Memorial Medical Center, into the National Center for Geriatric Health and Research Institute as a tertiary teaching, training, National Geriatric Specialty Center and Research Institute, which shall serve as the apex and end referral facility in the country for geriatric-related diseases under the direct control and supervision of the Department of Health for the benefit of senior citizens. The provision of the following powers and functions of NCGHRI, among others: establish, operate, equip, maintain an integrated medical institution which shall specialize in geriatric health services, formulate a hospital development plan which shall be regularly updated to reflect the expansion and future development of NCGHRI. Provide and maintain affordable, quality, and timely people-centered hospital care through an efficient health service delivery system for senior citizens. Provide higher and up-to-date geriatric training for professionals, postgraduates, academics, and allied healthcare providers, especially from the geriatric specialty centers in the regions and the LGUs and other government hospitals. And lead in the establishment of geriatric specialty centers in DOH hospitals by providing specialty training and technical assistance in collaboration with concerned DOH offices and other relevant professional organizations. It also mandates the NCGHRI to provide the following services, among others: hospital-based services to ensure the availability of medical facilities and equipment for senior citizens needing acute and subacute care, geriatric palliative care, transitional and outpatient care services, and such other necessary services. Community-based services utilizing multidisciplinary team approaches such as home-based healthcare and reablement programs, research and external resource outsourcing for community-based integrated geriatric health services, and trainings necessary for the psychosocial functioning of senior citizens and their families in coordination with local government units. Technical assistance and capacity building in the installation or establishment and maintenance of nursing homes and residential care facilities and senior citizens wards in government hospitals pursuant to Republic Act number 9994, otherwise known as the Expanded Senior Citizens Act of 2010, and technical assistance and capacity building in the establishment of geriatric specialist centers and services to strengthen the network of geriatric care across the country and ensure the delivery of quality health services for senior citizens. In addition, it establishes geriatric specialty centers in DOH hospitals, which shall serve as apex or end referral hospitals of the healthcare provider networks and training and research facilities on geriatric specialty care services. It also establishes geriatric subspecialty specialty subcenters in all government hospitals and makes available geriatric health services in all government primary health facilities. Further, the bill mandates the NCGHRI to submit an annual report on its activities, accomplishments, and recommendations to further improve the integrated delivery of geriatric health services. Also, it provides for income retention from all income generated from the operations of NCGHRI to be used to augment the hospital's maintenance and other operating expenses and capital outlay requirements. And finally, it exempts from income, donors, and all other kinds of taxes, all donations, contributions, grants, bequests, or gifts in cash or in kind received by the NCGHRI. As the elderly population is likely to increase in the future, and there is a definite shift in the disease pattern that is from communicable to non-communicable, the state is duty-bound to address the needs of the elderly as provided for under our Constitution. It is high time that the healthcare system gears itself into growing health needs of the elderly in the optimal and comprehensive manner. Dr. Grace Hardaleza Fernandez, one of the pioneers in the field of geriatric medicine in the country, emphasized that disease and disability are not part of old age, and help must be sought to address these health problems. The concept of active and healthy aging needs to be promoted, not only among the elderly, but the younger age groups as well, which includes the promotional and preventive and rehabilitative aspects of health. Madam Speaker, my dear colleagues, a wise man once said that the best classroom in the world is at the feet of the elderly person. But how will we be able to learn from this classroom if these decrepit appendages are already 6 feet under us? Madam Speaker, this bill is the answer to that. I therefore humbly ask for your favorable support for the immediate approval and passage of this measure. Thank you, Madam Speaker.
Majority Leader.
Madam Speaker, there being no other member who wishes to interpolate the sponsor, I move that we close the period of sponsorship and debate.
Is there any objection? The chair hears none. The motion is approved. Majority Leader.
Madam Speaker, I move that we open the period of amendments.
Is there any objection? The chair hears none. The motion is approved.
Madam
Majority.
Speaker, there being no other member who wishes to introduce committee amendments nor individual amendments. I move that we close the period of amendments. I so move, Madam Speaker.
Is there any objection? The chair hears none. The motion is approved.
Madam Speaker, I move for vote for second reading House Bill 10697. I so move, Madam Speaker.
Those who are in favor say aye.
Aye.
Those who are against say nay. The ayes have it. House Bill 10697 is approved on second reading. Majority Leader.
Madam Speaker, I move for to resume consideration on House Bill 10701 under Committee Report 1429 submitted by the Committee on Health. And for this purpose, may I request the Secretary General be directed to read the title of the bill. I so move, Madam Speaker.
The Secretary General is directed to read the title of the bill.
House Bill 10701, an act granting mandatory continuing benefits to public, private, and barangay health workers during the COVID-19 pandemic and other future public health emergencies, and appropriating funds therefore.
Majority Leader.
Madam Speaker, parliamentary status of the bill is in the period of sponsorship and debate. And may I recognize Honorable Stella Luz Kimbo to sponsor the measure.
The Honorable Stella Luz Kimbo is recognized to sponsor the measure.
Ay,
Majority
Madam
Leader.
Speaker, I withdraw my motion. I move that we recognize Honorable Cheryl Deloso Montalia to sponsor the measure.
Session suspended. Session resumed. Majority Leader.
Madam Speaker, I will reiterate my motion. The parliamentary status of the bill is that it is in the period of sponsorship and debate, and I move that we recognize Honorable Cheryl Deloso Montalia to sponsor the measure.
The Honorable, is there any objection on the motion? Hearing none, the motion is approved, and the Honorable Cheryl Deloso Montana is recognized to sponsor the measure.
Good afternoon once again, Madam Speaker, my dear colleagues. I am here this afternoon in behalf of the chairperson of the Committee on Health, Representative Angelina Helen Dieltan, to sponsor House Bill number 10701 as contained in the committee report number 1429 and entitled An Act Granting Mandatory Continuing Benefits to Public, Private, and Barangay Health Workers during the COVID-19 pandemic and other future public health emergencies and appropriating funds therefore. As the coronavirus COVID-19 pandemic has unfolded for over 2 years now, time often feels like it's slowed to a standstill. The onslaught of news headlines has made it difficult for the general public to discern how worried we should be. And so the attempts to flatten the curve have been done thus far. People have rushed to stockpile food, goods, and masks, swept up in the flurry of making sure they have enough. In the urgency of it all, we have forgotten to thank the people at the center of it all, our courageous health workers. Across the world, millions of health workers have selflessly dedicated countless days and nights to help those suffering from COVID-19. Such a mission requires great bravery, dedication, and sacrifice that should be acknowledged. Madam Speaker, one might ask, who are these health workers? Health workers, as used in this bill, refer to all public and private medical, allied medical, and other necessary personnel assigned in the hospitals, health facilities, laboratories, medical or quarantine facilities, or vaccination sites, and those administering medical assistance, regardless of employment status. It also includes non-medical workers and outsourced personnel hired under institutional or individual contract of service or job order basis who are similarly exposed to COVID-19 or other similar threats in times of public health emergencies. Barangay health workers or BHWs assigned in the hospitals, health facilities, laboratories, medical or quarantine facilities, or vaccination sites, and those administering medical assistance, including those assigned in the barangay health response teams or their successor entities, are included as health workers for purposes of this bill. Our health workers have long been charged with the noble, awe-inspiring, messy, and exhausting work of caring for the sick and suffering. They have the enormous privilege of carrying the burden of preserving human dignity amid uncertainty. During this pandemic, they brought hope to what, in some cases, may be the worst days of their lives. Health workers hold a beautiful contradiction. To be able to walk alongside another person during moments of vulnerability requires a special types of selflessness and strength. Most days, being a health worker feels like a calling. It is the most essential, impactful, rewarding type of work. But there's a reason why healthcare delivery is often referred to in terms of war metaphors. Health workers are in the trenches and on the front lines of care. They go into battle, and if they are lucky, they emerge unscathed. But more often than not, health workers carry emotional and physical battle scars. While their conviction to put COVID-19 at bay and their dedication to protect the Filipino public from dreaded virus is priceless, they must have some form recompense from the government in recognition of their sacrifices, which put their lives at risk of infection and probably death. Under the two Bayanihan laws that we have, we provided fund allocation for the risk allowances, but we can only surmise why there are a lot of health workers who either receive less than the minimum risk allowance as provided by law or have never received them at all. This is the injustice that we want to address in this bill. House Bill number 10701 under Committee Report number 1429 aims to promote the welfare of health workers by providing them with mandatory benefits with utmost efficiency, especially during a national public health emergency, to ensure the continuous delivery of health services and the prevention of diseases among our people. The key provision of this bill provides for the following benefits to health workers during public health emergencies. Special Risk Allowance, or SRA, for all health workers covered by this Act for every month of service during a state of public health emergency based on the following risk exposure categorization. Those employed in low risk shall be given at least 3,000 pesos. Such amount shall be given to health workers performing administrative duties in non-public areas of health facilities away from other staff members or away from patients, otherwise known as clean areas. Those deployed in medium risk areas shall be given at least 6,000 pesos. Such amount shall be given to health workers within the health facility that are providing direct physical care to the general public who are not known or suspected patients and working at busy staff work areas within a health facility. And those employed in high-risk areas shall be given at least 9,000 pesos. Such amount shall be given to healthcare workers entering patient's room or facility to directly provide care for a patient. The SRA shall be released monthly in addition to the existing benefits that the health workers receive. If a health worker physically reports for at least 12 hours in a month, the 12 days in a month, the SRA shall be released in full. Otherwise, the benefit shall be prorated. The DOH may increase the amounts of SRA subject to the approval of the President and in consultation with the DBM. Compensation for covered health workers who have contracted COVID-19 and such other diseases or illness in the line of duty during a state of public health emergency with the following amounts upon submission of required documents to support the claims. Number one, in case of death, 1 million pesos shall be provided to the heirs of the covered individuals. Number two, in case of sickness, for a severe or critical case, 100,000 pesos shall be provided to the covered individuals. In case of sickness for a mild or moderate case, 15,000 pesos shall be provided to the covered individuals. The compensation provided herein shall be given to the beneficiaries not later than 3 months after the date of confinement or death, as the case may be. Full Philippine Health Insurance Corporation coverage for health workers who are admitted to the hospital with confirmed COVID-19 infection and such other illness, disease or illness which is the subject of public health emergency declaration. Mandatory testing of health workers every 15 days or as often as necessary as may be determined by DOH, which shall be fully covered by PhilHealth. Continuous compensation for health workers who have contracted COVID-19 in the line of duty or any disease or illness during a public health emergency in the future. This also provides for the retroactive application of the said benefits from July 1, 2021 and shall remain in full force and effect during the state of national public health emergency until lifted by the President. Madam Speaker, with this bill, I would like to thank our health workers who run towards the line of danger as the rest of us retreat into the safety of our homes. This was not a battle that they signed up for, but it is one of which they are taking up arms and fighting regardless. They have done the mental calculus and against human nature chosen selflessness over self-preservation. Not just today in the war against the invisible enemy that is COVID-19, but every time they step out of their home to apply themselves to their jobs. Thank you to our dear health workers for choosing to serve and care for those who might be afflicted with the virus, even though the mere act of caring for them may put yourself and your loved ones at risk. During this unprecedented period of time, marked with angst and anxiety, what a few have referred to as our generation's world war, we thank you for being the helpers and heroes we look to. It is never easy work and few will understand why you do it, but you shoulder on, ready to fight another day. Madam Speaker, my dear colleagues, please join me in expressing our gratitude to them by supporting the immediate passage of this bill. Thank you, Madam Speaker.
Majority Leader.
Madam Speaker, there being no other member who wishes to interpolate the sponsor, I move that we terminate the sponsorship and debate. I so move, Madam Speaker.
Is there any objection? The chair hears none. The motion is approved.
Madam
Majority
Speaker,
Leader.
Madam Speaker, I move that we open the period of amendments.
Is there any objection? The chair hears none. The motion is approved.
Madam Speaker, there being no committee amendments, I move that we now proceed to consider the individual amendments. I so move, Madam Speaker.
Is there any objection? The chair hears none. The motion is approved.
Madam Speaker, I move that we recognize Honorable Carlos Isagani T. Zarate, Bayan Muna Party List for his individual amendments. I so move, Madam
The
Speaker.
Honorable Carlos Zarate is recognized for his individual amendment.
Thank you, Madam Speaker. Good afternoon. We would like to propose certain amendments to Committee Report number 1429 on House Bill number 10701, shortly titled the Public Health Emergency Benefits for Health Worker Staff. May I proceed, Madam Speaker?
What does the House say?
Madam Speaker, I move that we adopt the amendments.
Is there any objection? The chair hears none. The motion is approved.
Thank you, Madam Speaker. On page 3, section 5, grant of risk allowance, compensation package, and other benefits. After the letter A, special risk allowance, insert the following. B, active hazard duty pay, in parentheses, AHDP,
Committee muna, bago House. Simultaneous, di ba? Tanungin mo na yung committee.
What does the sponsor say
I'm not yet,
relative to the amendment?
may I proceed? I have to finish. May I proceed, Madam Speaker? I was interrupted.
With the first amendment, may we know what does the sponsor say from the first amendment?
Madam Speaker, on behalf of the Committee on Health, this representation interposes no objection.
What does the House say?
Madam Speaker, on behalf of the majority, I move that we adopt the amendments.
Is there any objection? The chair hears none. The motion is approved. Majority Leader.
Madam Speaker, may I just restate the amendment for clarity? To insert the following: B, active hazard duty pay in the amount of 5,000 pesos for every month served by the health workers, provided that the AHDP shall be in addition to the existing benefits and the health workers receive.
What does the sponsor say?
We interpose no objection, Madam Speaker.
What does the House say?
Madam Speaker, I move that we approve the amendments.
Is there any objection? The chair hears none. The motion is approved.
Thank you, Madam Speaker. Also, to insert letter C, life insurance.
What does the sponsor say?
We accept, Madam Speaker.
What does the House say?
Madam Speaker, on behalf of the majority, I move that we adopt the amendments.
Is there any objection? The chair hears none. The motion is approved.
And finally, to insert letter D, accommodation, transportation, and meals allowance regardless of the community quarantine status. Thereafter, renumber the succeeding subsections accordingly.
What does the sponsor say?
We accept the amendment proposed by Honorable Zarate, Madam Speaker.
What does the House say?
Madam Speaker, I move that we approve the amendments.
Is there any objection? The chair hears none. The motion is approved.
I have no further proposed amendments, Madam Speaker.
Majority Leader.
Madam Speaker, there being no other individual amendments, I move that we close the period of individual amendments. I so move, Madam Speaker.
Is there any objection? The chair hears none. The motion is approved. Majority Leader.
Madam Speaker, I move that we vote on second reading House Bill 10701. I so move, Madam Speaker.
Those who are in favor say aye. Those who are against say nay. The ayes have it. House Bill 10701 is approved on second reading. Majority Leader.
Madam Speaker, we are in receipt of the Bicameral Conference Committee report on the disagreeing provisions of House Bill number 9007 and Senate Bill number 2239 on regulating the importation manufacture, sale, packaging, distribution, use and communication of vaporized nicotine and non-nicotine products and novel tobacco products. I so move, Madam Speaker.
Those who are in favor say aye. Those who are against say nay. The ayes have it. The bicameral conference committee report as mentioned is now ratified. Majority Leader.
Madam Speaker, for omnibus consideration, approval on second reading local bills under higher and technical education, I move that we consider House Bill 10694 under Committee Report 1424. And House Bill 10702 under Committee Report 1430 submitted by the Committee on Public Works and Highway. And for this purpose, may I request the Secretary General be directed the following titles of the bills.
The Secretary General is directed to read the titles of the following bills.
House Bill 10694, an act converting the Cebu Technological University into a university system to be known as the Cebu Technological University System and appropriating funds therefore. House Bill 10702, an act converting the Sawang Bahalas Road in the municipality of Romblon, province of Romblon, into a national road and appropriating funds therefore.
Majority Leader.
Madam Speaker, I move that we consider the respective explanatory notes as the sponsorship of the said measures. I so move, Madam Speaker.
Is there any objection? The chair is none. The motion is approved. Majority Leader.
Madam Speaker, there being no other member wishes to interpolate on the said local bills, I move that we terminate the period of interpolation. I so move, Madam Speaker.
Is there any objection? The chair hears none. The motion is approved.
Madam Speaker, I move that we open the period of amendments and approve the committee amendments, if any, as contained in the respective committee reports of the aforementioned bills. I so move, Madam Speaker.
Is there any objection? The chair hears none. The motion is approved. Majority Leader.
Madam Speaker, there being no other individual amendments, I move that we terminate the period of amendments. I so move, Madam Speaker.
Is there any objection? The chair hears none. The motion is approved.
Madam Speaker, I move that we vote on second reading the following House bills: House Bill 10694, House Bill 10702.
Those who are in favor say aye.
Aye.
Those who are against say nay. The ayes have it. House Bill 10694 and House Bill 10702 is now approved on second reading. Majority Leader.
Madam Speaker, 1 minute suspension.
Session suspended. Session resumed. Majority Leader.
Madam Speaker, I move that we recognize Honorable Franz Castro for her personal and collective privilege. I so move, Madam Speaker.
What's the nature of your personal privilege, the Honorable Franz Castro?
Thank you, Majority Leader. Madam Speaker, I'm going to talk about the twice a month salary scheme implemented by Department of Education. to
Yes,
our
you may
teachers.
proceed. You have 3 minutes.
Muli, Madam Speaker, maraming salamat po sa ating pong mga kapwa kinatawan, kababayan, at sa ating mga kaguruan. Magandang hapon po sa lahat. Ako po ay tumatayo dito for personal and collective privilege. Madam Speaker, nung itong pagtuntong ng January, naranasan natin ang spike ng COVID-19, Omicron. Dobling dagok ang naranasan ng mga guro dahil marami sa kanila yung mga nagkasakit at isa pang dagok ang naranasan nila dahil nitong January ay ipinatupad ng Department of Education itong tinatawag na bi-monthly salary release scheme na kung saan, Madam Speaker, wala pong kaabog-abog, wala man lang consultation at wala man lang pasabi sa ating mga teachers, mga stakeholders na ipatutupad na pala yung twice a month salary release scheme. So, nung unang linggo ng January, ako po ay nag-text kay Yusek Ann Sevilla, kaugnay sa tanong na ito ng mga teachers kung ipatutupad na itong bi-monthly dahil naririnig-rinig nila ito at marami, Madam Speaker, ang nagtatanong. Kaya po ako po ay nag-text kay Yusek Sevilla, pero nakakalungkot, hindi man lang po ako sinagot. At nalaman natin noong January 15, ipinatupad itong twice a month salary increase. Madam Speaker, marami pong mga guro ang nagtaka. Bakit man lang po ay hindi man lamang nagkaroon ng consultation sa ating mga guro na siyang nakapaloob doon sa Magna Carta for Public School Teachers at syempre doon sa collective negotiation agreements ng DepEd at ng mga unions, particular sa NCR, Region 6, Region 7, Region 11, and Region 3, at iba't iba pang mga organizations. Sa bahagi ito, Madam Speaker, tingin ko ay nineglect itong basic na step na ito ng Department of Education, itong democratic processes. Marami pong mga disadvantages ang binanggit ng mga guro sa representasyong ito kaugnay ng ganitong iskema. Una po ay additional expenses on the transaction fees or bank charges kapag dalawang beses na ibibigay yung sweldo. Anong mangyayari sa kanilang mga obligasyon katulad ng payment ng mga mandatory deduction, GSIS, PhilHealth, Pag-ibig, union dues, and other obligation? Pati na rin, Madam Speaker, yung kanilang mga loans. Karamihan po ng mga guro ay sumusweldo lamang ng nag-average ng 5,000 to 10,000 at hahatiin pa ito. So ang urgent demand ng ating mga guro, Madam Speaker, ay sana immediately suspendihin ang iskemang ito at immediately rin mag-conduct ang Department of Education ng consultation sa ating mga teachers unions and other organizations and other stakeholders. So ito lamang po, Madam Speaker, at sana po mapakinggan ng Department of Education ang hinaing na ito ng ating mga kaguruan. Maraming salamat, Madam Speaker.
Majority Leader.
Madam Speaker, I move that we refer the speech of Honorable Franz Castro to the Committee on Rules for its appropriate action. I so move, Madam Speaker.
Is there any objection? The chair hears none. The motion is approved. Majority Leader.
Madam Speaker, I move that we consider House Resolution 2470, and for this purpose, may I ask the Secretary General read the title of House Resolution.
The Secretary just directed to read the title of the bill.
House Resolution 2470. Resolution congratulating Filipino Olympian Paul Volter, Ernest John E.J. Obiana for winning the silver medal at the Paris Diamond League and the gold medal at the 17th International Golden Roof Challenge held in Austria, and commending his achievement for setting the new Asian record for the highest leap in pole vault.
Majority Leader.
Madam Speaker, I move that we adopt House Resolution
Those who are in favor.
House Resolution 2470. I so move, Madam Speaker.
Those who are in favor say aye.
Aye.
Those who are against say nay. House Resolution, the ayes have it. House Resolution 2470 is now adopted. Majority Leader.
Madam Speaker, I move that we consider for second reading local bills, House Bill number 10704, and for this purpose, may I ask the Secretary General be directed to read the title of the bill.
The Secretary General is directed to read the title of the House Bill.
House Bill 10704, an act strengthening the Mindanao State University system and appropriating funds therefore.
Majority Leader.
Madam Speaker, I move that we consider the explanatory note as the sponsorship of the said measure. I so move, Madam Speaker.
Is there any objection? The chair hears none. The motion is approved. Majority Leader.
Madam Speaker, I move that we open the period of amendments and approve the committee amendments, if any, as contained in the committee reports of the said House bill.
Is there any objection? The chair hears none. The motion is approved.
Madam Speaker, there being no individual amendments, I move that we terminate the period of amendments.
Is there any objection? The chair hears none. The motion is approved.
Madam Speaker, I move that we vote on second reading House Bill 10704. I so move, Madam Speaker.
Those who are in favor say aye.
Aye.
Those who are against say nay. The ayes have it. House Bill 10704 is now approved on second reading. Majority Leader.
Madam Speaker, I move that we consider House Bill number 10703 under Committee Report 1431, submitted by the Committee on Revision of Laws and other purposes. Madam Speaker, I request the Secretary General to please read the title of the measure.
The
So moved,
Secretary
Madam
General is
Speaker.
directed to read the title of the House Bill.
House Bill 10703, an act prohibiting all forms of sexual abuse or exploitation of children.
Majority Leader.
Madam Speaker, I move that we open the period of sponsorship and debate. So
Is there
moved,
any
Madam Speaker.
objection? The chair hears none. The motion is approved. Majority Leader.
Madam Speaker, I move that we recognize Representative Cheryl De Losa Montalia.
The
To sponsor
Honorable
the said
Cheryl De
measure.
Losa
So moved.
Montana is recognized to sponsor the measure.
Thank you, Madam Speaker. Good afternoon, Madam Speaker and my dear colleagues. I stand before this august chamber as the chairperson of Committee on Revision of Laws and as a principal author to ask for your full support to the measure House Bill number 10703, an act prohibiting all forms of sexual abuse or exploitation of children, that will hopefully end the silent pandemic in the Philippines, the commission of online and offline sexual abuse or exploitation of children. According to endviolence.org, across the world, children's lives are being shaped in two worlds, the physical and the digital. But more often than not, those worlds blend into one. Today's children are more interconnected than ever. With over 4 billion internet users across the world, the limits of children's experiences are no longer bound by their bedroom doors, their classroom walls, or the borders of their nation. Unfortunately, the same can be said for the rest of the world, including those seeking to harm children. As the internet's reach grows, every day, the number of children at risk of online sexual exploitation and abuse multiplies. With all of its many advantages and opportunities, particularly during this pandemic, one of the unforeseen consequences of the rise of the internet and digital technologies has been an exponential growth in the online child sexual exploitation and abuse, especially through the illicit generation and sharing of child sexual abuse images and videos. More than 200,000 children go online every day, and 800 million are actively using social media. Couple that with the fact that at any given time, an estimated 750,000 individuals are looking to connect with children for sexual purposes online. The explosion of smartphone technology and the world has only catalyzed this threat, and the resulting statistics are incredibly alarming. From 2013 to 2018, the number of dark web users increased from 1 to 4 million. Users of the dark web can remain anonymous and for the most part untraceable. Because of this, many of the worst forms of child abuse happen through the dark web. studies show that younger children are at an even higher risk of online sexual exploitation, with 89% of victims between 3 and 13 years old. The global threat assessment conducted by the We Protect Global Alliance cited that one of the many hidden internet services dedicated to the abuse of infants and toddlers contained over 18,000 registered members, with another similar forum receiving over 23 million visits. In addition, a survey conducted by the Canadian Centre for Child Protection indicates that 56% of the child abuse online began before the age of 4, and 42% were abused for more than 10 years. And reports received by the Internet Watch Foundation show that in the United Kingdom, and half of online child sexual abuse cases involve children under age 10. And 1/3 of those images involve rape and sexual torture. Madam Speaker, there were 73.91 million internet users in our country as of January 2021. There were 1.2 million online tips about alleged activities involving online sexual exploitation of children for the year 2020 alone. This is 3 times the 400,000 reports received in 2019 by the Interagency Council Against Trafficking, or IACA. The Department of Justice Office of Cybercrime, on the other hand, received at least 600,000 cyber tips of sexual images of Filipino children in 2018. This is more than a 1,000% increase from the previous 45,645 in 2017. But these are only reported. Definitely, there are unreported cases, not to mention those offline commission of sexual abuse or exploitation of children that have or have no online component. My fellow legislators, current data from the United Nations International Children's Emergency Fund, or UNICEF, clearly speak that there are 2 in every 3 Filipino children who experience physical violence, 2 out of 5 children who experience psychological violence, 1 out of 4 children who experience sexual violence, 2 out of 3 children who experience peer violence, and there is 1 in every 5 Filipino children who are vulnerable to online sexual exploitation. This is the sordid picture of the Filipino children, our own children, our future. UNICEF and the Child Rights Network reported that a number of factors in the Philippines allow for easy proliferation of online sexual exploitation of children, or OSEC. These include, number 1, widespread poverty resulting to OSEC as a form of income. Number 2, cheap internet and smartphones. Number 3, ability to speak English well. Number 4, wide availability of money remittance centers. Number 5, prevailing norms of secrecy. Number 6, lack of parental supervision, sometimes caused by parents having to work abroad. Number 7, lack of resources to investigate and prosecute perpetrators and rescue and rehabilitate victims. UNICEF also noted the alarming involvement of children's own family members as crime facilitators. Madam Speaker, the Economist Impact Global Study reported that while most companies use tools to detect sexual abuse materials, only 37% currently use tools to detect other methods of sexual abuse or exploitation, like online grooming of children. We do not have sufficient laws to protect our children against online sexual abuse or exploitation. Our current laws cannot cover the full range of online sexual abuse or exploitation activities. I believe that it is timely to revisit Republic Act number 9775, otherwise known as the Anti-Child Pornography Act, and other laws related to online sexual abuse or exploitation of children. On this premise, we came up with House Bill number 10703 that will surely protect all children by preventing, responding, and possibly ending online or offline child sexual abuse or exploitation. In this bill, we will sternly punish all forms of child sexual abuse or exploitation committed either online or offline, or a combination of both, and impose stiffer penalties for the different kinds of acts and participation in the crime. We will also further inculcate corporate responsibilities on the part of the internet intermediaries and other internet or payment service providers by reporting, blocking, taking down, or removing websites containing online child sexual abuse or exploitation materials, as the case may be. Under this bill, we created the interagency that supersedes the Interagency or Anti-Child Pornography Council. We also developed a system of reporting, referral pathway, database, and protocols in detecting, averting, and prosecuting online or offline child sexual abuse or exploitation activities. We also aligned the provisions of this bill with international standards on averting the offline or online generation or production of child sexual abuse or exploitation materials. We holistically, meticulously, and diligently crafted House Bill number 10703 to certainly put an end to this silent pandemic targeting our children, our future as a nation. Madam Speaker, my dear colleagues, Mahatma Gandhi said that the true measure of any society can be found in how it treats its most vulnerable members. Times of crisis make clearer who the most vulnerable members of society are. They are always there, but too often people tend to ignore until something makes them more visible. This is such a time. The weaknesses in our society are on plain display these days, and I worry that the cracks and division in our society will become more pronounced before solutions begin to be implemented. Madam Speaker, my most esteemed colleagues, let us protect our most vulnerable sector, our children, by supporting the immediate passage of this bill. Thank you, Madam Speaker, and good afternoon.
Majority Leader.
Madam Speaker, there being no other member who wishes to interpellate, I move that we terminate the period of sponsorship and debate. So move, Madam Speaker.
Is there any objection? The chair hears none. The motion is approved.
Madam Speaker, we move that we suspend consideration of the said measure.
Is there any objection? The chair hears none. The motion is approved. Majority Leader.
Madam Speaker, I move that we elect following House members in the Bicameral Conference Committee on House Bill numbered 9458, an act granting night shift differential pay to government employees, including those in government-owned or controlled corporations, and appropriating funds, therefore, and Senate Bill number 643, an act granting night shift differential pay to the government employees, including those in government-owned or controlled corporations, and appropriating funds, therefore. For the majority, Honorable Eric Goyap, Honorable Strike B. Revilla, Honorable Ruel Peter S. Gonzaga, and Honorable Julian Jamboronda. For the minority, Honorable Jose Christopher Y. Belmonte. I so move, Madam Speaker.
Is there any objection? The chair hears none. The motion is approved.
Madam Speaker, I move for the reconsideration of the adoption of findings and recommendations as contained in Committee Report number 1393 on House Resolution number 1711, inquiry on the policies and guidelines of the Department of Health and the Food and Drug Administration for the registration, utilization, manufacture, distribution, or sale of drug products for the coronavirus disease. I so move, Madam Speaker.
Is there any objection? The chair hears none. The motion is approved. The adoption of the findings and recommendations as contained in committee's report number 1393 on House Resolution number 1711 is hereby reconsidered.
Madam Speaker, I move that we recommit committee report number 1393 on House Resolution number 1711 to the Committee on Good Government and Public Accountability. I so move, Madam Speaker.
Is there any objection? The chair hears none. The motion is approved. Committee report number 1393 on House Resolution number 1711 is hereby recommitted to the Committee on Good Government and Public Accountability. Majority Leader.
Madam Speaker, I move for the change of referral of the following measures. House Bill number 9920, amending Republic Act number 10699, otherwise known as an act expanding the coverage of incentives granted to national athletes from the Committee on Youth and Sports Development to the Committee on Ways and Means. House Bill number 10574, amending Section 6B and Section 8 of Republic Act number 10575, otherwise known as the Bureau of Corrections Act of 2013, from the Committee on Public Order and Safety to the Committee on Justice. House Resolution number 2369, inquiry on the delayed release of the unconditional cash transfer funds under the Tax Reform for Acceleration and Inclusion Train Law, from the Committee on Social Services to the Committee on Poverty Alleviation. So move, Madam Speaker.
Are there any objections? The chair hears none. The motion is approved.
Madam Speaker, I move that you resume consideration on House Bill number 1073, Committee Report 1431. So move, Madam Speaker.
The Secretary General is directed to read the
Madam
title
Speaker,
of
I
the
move
bill.
that the Secretary General be directed to read the title of the bill. So move, Madam Speaker.
House Bill 10703, an act prohibiting all forms of sexual abuse or exploitation of children.
Majority Leader.
Madam Speaker, the parliamentary status of the bill has already terminated the sponsorship and debate. May we recognize Chairman Cheryl.
Session suspended. Session resumed. Majority Leader.
Madam Speaker, I move to recognize Chairperson Cheryl De Loso Montalia to sponsor the said measure. So
The
move, Madam
Honorable
Speaker.
Cheryl De Loso Montalia is recognized.
Madam Speaker, I have just sponsored our House Bill 10703. I think we're already in the period of individual amendments.
Majority Leader.
Madam Speaker, I move that we open the period of amendments.
Is there any objection? The chair hears none. The motion is approved.
Madam Speaker, there being no committee amendments, I move that we now proceed to consider the individual amendments. So move, Madam Speaker.
Is there any objection? The chair hears none. The motion is approved.
Madam Speaker, I move that we recognize Representative Lawrence Law Fortune for his individual amendment.
The Honorable Lawrence Fortune is recognized for the individual amendment.
Thank you, Madam Speaker. Thank you, distinguished sponsor. Madam Speaker, I propose individual amendments to Committee Report 1431 on House Bill number 10703. First proposed amendment, Madam Speaker, is to amend the title on page 1 of House Bill 10703, an act prohibiting all forms of sexual abuse or exploitation of children, to read as follows, Madam Speaker. An act strengthening the protection against online or offline child sexual abuse or exploitation. I so move, Madam Speaker.
How does the sponsor say?
Madam Speaker, I move that we
What is the pleasure from the sponsor on the individual amendment just mentioned?
Madam Speaker, we interpose no objection and we accept the proposed amendments by Honorable Lawrence Fortune.
What does the House say?
Here, in behalf of the majority, we move to adopt the said individual amendment. So move, Madam Speaker.
Are there any objections? The chair hears none. The motion is approved.
Further
Majority
amendment,
Leader.
Madam Speaker. On lines 1 and 2 of Section 2, I move that we replace the phrase anti-sexual abuse or exploitation of children with this act shall be known as the Anti-Online or Offline Child Sexual Abuse or Exploitation Act of 2022. So that the paragraph shall read as follows, Madam Speaker. Section 1, short title, this act shall be known as the Anti-Online or Offline Child Sexual Abuse or Exploitation Act of 2022. I so move, Madam Speaker.
What does the sponsor say? Yes, Madam Sponsor.
Apologies, Madam Speaker, I cannot unmute my device. We interpose no objection, Madam Speaker, and we accept the amendment proposed by Honorable Fortune on Section 2 of the measure.
What does the House say?
Madam Speaker, on behalf of the majority, we move for the adoption of the said individual amendment. So move, Madam Speaker.
Are there any objections? The chair hears none. The motion is approved.
Further amendment, Madam Speaker. On page 3, line 23 of Section 3 of subsection B, we add the word or before the word through and after with. Hence, the entire paragraph shall read as follows, Madam Speaker. D, child sexual abuse or exploitation material refers to any representation, whether offline or by, through, or with the use of information and communications technology by means of visual, video, audio, written, or any combination thereof, by electronic, mechanical, digital, optical, magnetic, or any other means of child engaged or involved in real or simulated explicit sexual activities or depicting acts of sexual abuse or exploitation of a child as a sexual object. Shall also include materials that focus on the genitalia or other private body parts of the child. I so move, Madam Speaker.
How does the sponsor say?
Madam Speaker, we interpose no objection. We accept the amendment proposed by Honorable Fortune on Section 3 of the measure.
What does the House say?
Madam Speaker, on behalf of the majority, we move to adopt the said individual amendment. So move, Madam Speaker.
Is there any objection? The chair hears none. The motion is approved.
Thank you, Madam Speaker. Further amendment, Madam Speaker, on page 5, line 1, section 3, subsection J, before the word child, add or someone who is believed to be a. Hence, the entire paragraph shall read as follows, Madam Speaker. Grooming refers to a predatory conduct, act, or pattern of acts of establishing a relationship trust, or emotional connection with a child or someone who is believed to be a child and or the family, guardian, and or caregivers, whether in person or via electronic and other similar devices, for the purpose of perpetrating sexual abuse or exploitation. I so move, Madam Speaker.
What does the sponsor say?
Madam Speaker, we interpose no objection. We accept the proposed amendment by Honorable Fortune on Section 3, subsection J of the measure.
What does the House say?
Madam Speaker, on behalf of the majority, we move to adopt the said proposed individual amendment. So move, Madam Speaker.
Is there any objection? The chair hears none. The motion is approved. Majority Leader.
For amendment, Madam Speaker, on page 6, line 1 of section 3 of subsection R, delete the words "to the public" so that the entire paragraph shall read as follows: internet cafe of kiosk refers to an establishment that offers or proposes to offer services for the use of its computers or computer system for the purpose of accessing the internet, computer games, or related services. I so move, Madam Speaker.
What does the sponsor say?
Madam Speaker, we interpose no objection. We accept the proposed amendment by Honorable Fortune on Section 3 and subsection R of the measure.
What does the House say?
Madam Speaker, on behalf of the majority, we move to adopt the said individual amendment. So move, Madam Speaker.
Are there any objections? The chair hears none. The motion is approved.
And finally, Madam Speaker, on page 9, line 22 of section 7, to add a new subparagraph, which shall be subparagraph 8, Madam Speaker, to read as follows: for internet intermediaries who have a policy on notifying their community to amend their policy and include provision on delaying notification to the account holder, subscriber, or customer of an internet service provider or platform who is a suspected offender of an act of online child sexual exploitation and abuse in an ongoing criminal investigation of the existence of a subpoena, warrant, court order, or other governmental request directing the internet service provider or platform to disclose information about the said account holder or subscriber. I so move, Madam Speaker.
What does the sponsor say?
Madam Speaker, we interpose no objection. We accept the individual amendment proposed by Honorable Lawrence Fortune on Section 7 of the measure. Yeah. Thank you, Madam Speaker.
What does the House say?
Madam Speaker, on behalf of the majority, we move to adopt the said proposed individual amendment. So move, Madam Speaker.
Are there any objections? The chair hears none. The motion is approved. Majority Leader.
Thank you, Madam Speaker.
Thank you, Madam Speaker.
Thank you.
Also our
Thank you.
very active chairperson.
Madam Speaker, there being no other individual amendments, I move that we close the period of individual amendments. So move, Madam Speaker.
Is there any objection? The chair hears none. The motion is approved. Majority Leader.
Madam Speaker, I move that we vote on second reading House Bill number 1073, Committee Report 1431, as amended, Madam Speaker. So move.
Those are in favor say aye.
Aye.
Those are against say nay. The ayes have it. House Bill 10703 is now approved on second reading. Majority Leader.
Madam Speaker, I move that we consider House Bill 10379 under Committee Report 1297 submitted by the Committee on Agriculture and Food. And for this purpose, may I ask the Secretary General be directed to read the title of the bill? I so move, Madam Speaker.
The Secretary General is directed to read the title of the bill.
House Bill 10379, an act providing for the development of the Pili industry, creating for the purpose Pili Research and Development Centers, establishing the Pili Subsidy Fund, and appropriating funds therefor.
Majority Leader.
Madam Speaker, I move that we open the period of sponsorship and debate.
Is there any objection? The chair hears none. The motion is approved. Majority Leader.
Madam Speaker, I move that we recognize Honorable Julian Jam Boronda to sponsor the measure. I so move, Madam Speaker.
The Honorable Jam Barondo is recognized to sponsor the measure.
Thank you, Madam Speaker. I move for the approval of House Bill. Madam Speaker, I move that we adopt the explanatory note of the said measure as my sponsorship speech. So move, Madam Speaker.
Majority Leader.
Madam Speaker, there being no other member who wishes to interpolate the sponsor, I move that we terminate the sponsorship and debate. I so move, Madam Speaker.
Is there any objection? The chair hears none. The motion is approved.
Madam
Majority
Speaker,
Leader.
Madam Speaker, I move that we open the period of amendments.
Is there any objection? The chair hears none. The motion is approved. Majority Leader.
Madam Speaker, there being no other member who wishes to introduce committee amendments nor individual amendments, I move that we close the period of amendments.
Is there any objection? The chair hears none. The motion is approved.
Madam Speaker, I move that we vote on second reading House Bill 10379. I so move, Madam Speaker.
Those who are in favor, say aye. Aye. Those who are against, say nay. The ayes have it. House Bill 10379 is now approved on second reading. Majority Leader.
Madam Speaker, I move that we adjourn session until January 31, 2 p.m.
The session is adjourned until January 31, 2 p.m.
Recording stopped.